Bismillahirrahmanirrahim. Assalamu alaikum everyone. Myself Dr. Mamoona Azhar. By profession I am a physiotherapist, and today I am going to deliver a lecture on the subject of evidence-based physiotherapy. As you guys know that we have started the evidence-based physiotherapy chapter number 1, where we have studied about what is evidence-based practice, how it is being done, what it can do, and what is the history of evidence-based practice. So here till here we were clear about the chapter number 1. So now we are moving towards the chapter number 2, and now all the chapters which are proceeding from this one, from the chapter number 2, they are constituting a single topic. They are addressing a single topic, and in that chapter we are going to clear all of the aspects regarding that single topic. So the chapter number 2 is regarding what do I need to know. Chapter number 2 says that what do I need to know about evidence-based physiotherapy. These are the some basic aspects, some very basic questions we need to be clear about before studying the topic, before identifying, before making any high quality clinical research, or before making any decision making in the field of physiotherapy. So here I have just turned on my laptop to get the reviews and to get the questions and to get all of the things from the book, so that I cannot skip any single particular content from the book. So for evidence-based physiotherapy, we need to know about the two conditions. There are two conditions that should be met. What are that one? The number one is the sense of uncertainty about the best course of intervention. For example, there comes a patient to us in the field of physiotherapy, in our hospital, in our clinic, and we are just checking that patient. Now we want to give a best clinical intervention, best treatment plan to patient, and we are not clear about that. We are unsure about that. So that is the point when we are not sure about the treatment, that which treatment is best for the patient and what kind of modality should be best for the patient and what kind of intervention can give the best outcome from the patient. Then in that situation, evidence-based physiotherapy is very much important. So first condition is being met. Now what is the second condition? In the second condition, it is about recognition that high quality clinical research could solve that uncertainty. Now there are some situations, there are some things which are still not identified and cleared in the field of research, but there are some questions that has been already addressed, and the intervention we are not clear about. We can be cleared about that intervention through evidence-based, through high quality clinical research, and through evidence-based practice. So these are the two conditions that should be met. What these two conditions are, I'm just going to give a quick review. That is uncertainty about the best course of intervention, and high recognition that high quality clinical research could fulfill that confusion. So now we are going to officially start chapter number 2. Before starting the chapter number 2, these were the few aspects, these were the few things which you guys needed to be clear, to identify, to read, and to analyze the chapter in detail. Now I'm moving towards chapter number 2. What do I need to know? The first question in evidence-based practice is to ask relevant clinical question. Now I'm just giving you a scenario which is being mentioned in your book, and then we will identify some of the questions that what do we need to know. For example, there is a Mr. Y who is 43-year-old and who is having acute back pain from 2 weeks. He does not have any apparent neurological deficit, and the problem arises after heavy weightlifting. Now Mr. Y, general practitioner, prescribed analgesics, anti-inflammatory drugs, and bed rest for 5 days. But this brought just a little improvement in the patient. Now patient comes to you. What you will do with the patient? This was the whole scenario, that a patient comes to us with that age, 45 to 47 years of age. He's having back pain. That problem or situation arises when he did the heavy weightlifting, and he has taken even the medications, but he is not recovered properly. So now when the patient comes to you, what you will do? Now the process, what we need to know comes here. Relevant clinical question. A well-known saying is that beginning of all wisdom lies not in the answer but in the question itself. So the point or the topic of mentioning relevant clinical question is that when we are coming or facing any situation, any kind of patient, any kind of intervention, or any kind of the patient having any kind of problem, what we need to do is we need to take out all the questions first, because all the answers are lied in the question. In this topic, in this chapter, we will come to know that how we can derive that effective clinical questions, so we can come towards the intervention, or we can come towards the end or intervention of the problem. So most physiotherapists, whenever a patient comes to the clinical setting, what they do, they take the history from the patient, the daily history, what did the patient do in the daily life, how did the problem happen. So it is the basic history which is being asked from the practitioner, which is being asked from the patient, that the patient face day to day life. For example, the patient says that I wake up, I go to job, I sleep, I eat this way, I have this pattern of sleeping, I have this pattern of walking, I have that occupation. So from all these conditions which the history the patient is giving, the practitioner gets to know more of the things and he can easily treat the patient. Other information needs are met by the practice and knowledge of the physiotherapist. For example, if the practitioner is having the knowledge about the condition, then he can identify really easily by getting to know about the history. And also, if a practitioner is having the knowledge and the experience, both of the things will combine and he can make the intervention regarding that situation. But some information needs are best provided by high quality clinical research. There are still some ambiguities which are not being clear, and how we can clear that ambiguities? Without those clarification of ambiguities, we cannot proceed further. Now for the clarification of these ambiguities, it is really necessary to focus on high quality clinical research. But this information may be hard to find, and tracking it down, as it is difficult in pressurized atmosphere of daily life. As a physiotherapist, as a practitioner, they are really busy in their daily life. It is really difficult for them to take out time for the high quality clinical research and what they will do in that situation. So the intention of this book is to help physiotherapists quickly to find important evidence, so that it will not be difficult for the physiotherapist to proceed further in their practical life, and for also the students who are studying it beforehand, so that they can practice it in the field when they come to the clinical setting. Now considering that topic, in the scenario we have before us, you are faced with a problem where a man is having the back pain, acute onset. What does this scenario stimulate you to ask? Now, what are those questions you can arise from these kind of conditions, from this kind of scenario, from this kind of patient? So from this scenario, what questions can be arisen? Is heavy weight lifting most likely the cause of the problem? It can be thought. That can be a sudden question that comes into mind, that patient did the heavy weightlifting and the problem arose. Now we can think that the question, relevant clinical question, we can make that, is heavy weightlifting most likely the cause of the problem? Now, can this problem be solved or prevented in the future? Other questions we can think that, how can we decide that there was no nerve root involvement? What test we can use to investigate that there is no malignancy or systemic disease or any systemic condition, or it is not a referral pain? What is the principal underlying condition? Now we need to know the exact actual cause of the condition. If my aim is to improve the functional capacity, should I advise the patients to stay active or have bed rest? Then what does he feel about staying in bed or returning to work? How does the pain or the pattern of functional activity changes when the patient is in the bed and goes back to the work? What can I do to relieve his pain in his period? If the patient comes to us is having the pain, what I can do for relieving the patient's pain? Then, is there anything I can do to speed up the recovery? So, all these questions are important. These are all the questions that can come into the mind of any person, any practitioner who have not even studied evidence-based physiotherapy. Now, what we need to do is we need to filter out the things. Filtration is just like that you are separating same kind of things. For example, I'm having different cushions at my home. Just like the way you can say that this is the yellow cushion, this is the yellow cushion. So all the yellow cushions should be kept together. Now this is the pink cushion. All the pinks should be kept together. The same way, all the cushions should be kept together. In that condition, in that situation, how we can categorize the questions? There are basic 4 categories which we need to develop, which we need to maintain for evidence-based physiotherapy. In the chapter number 2, that what do I need to know? The first one is effect of intervention. What can be effect of intervention is the first category. The second category is patient's experiences. The third category is the course of condition or prognosis, and the fourth category is accuracy of diagnostic test. Now, from all those questions we just maintained in a raw form, we will categorize all of the questions in the particular 4 categories, 4 classifications. The first one is effect of intervention. Now we are just going to rule out, we are just going to drag those raw questions into the actual categories. Now the first category was effect of intervention, and the questions which would come in this category is, could this problem which I see frequently in my practice be preventive? Like most of the patients come to me with this kind of pain. Can I prevent this condition? So this is the number 1 effect of the intervention. Then, if my aim is to improve functional life, if I want to improve the functional life of the patient, should I advise him to stay active or go to the bed? That is also the second effect of the intervention. That what would be actual effect of the intervention? Either we are going to recommend the bed rest, or either we are going to stay patient to have healthy and active life. So that was the second effect of the intervention. Now, what can I do to relieve his pain during this period? That is the third question. Now, how the patient pain can be reduced? What can I do? What that kind of modality or the treatment plan or the exercise or the manual therapy I can do to relieve that pain? So that is the third part of effect of the intervention. The fourth and very important and the last question is there anything I can do to speed up the recovery? So these are the all 4 questions which are going to be in the part of effect of intervention. Then there comes the second part, which I just mentioned, that experiences. And what questions does lie in the term of experiences? What does he feel about staying in bed or returning to work? So this is actually patient experience. That patient has experienced. What does patient experience when patient is on bed, and what does patient experience when patient is staying active or walking or running or just climbing the stair or doing any particular activity? So this is the patient experience which the patient will mention, and we will just categorize this situation. Then what is the principal underlying concern about the condition? Now the first one was the patient experience, and the second one is practitioner's experience, that how he can get to know that what is the underlying situation. There can be a referral pain, there can be a systemic condition, there can be a pain due to any other cause. So here comes clinical practitioner's experience that he would get to know that how did situation arose. Then comes prognosis. What would be prognosis is the basically what we can say that prognosis is the course of condition, that how this condition developed in the future, what this condition did with the patient in the future. Did it improve or did it worsen? So in prognosis part, what is the possibility or probability that problem, what is the possibility or probability that problem will resolve by itself within a month if we are not having any kind of intervention? What will happen to the condition? If you are giving medications to the patient, what will happen to the condition? And if you are giving the physiotherapy treatment plan, what will happen to the condition? So this is the prognosis which we need to maintain in the field or in the practice. Then comes diagnosis. In the diagnosis, we are going to apply some diagnostic tests. That can be tests from the lab, or that can be special tests, or that can be physiotherapy tests. These are all the tests which can help us to identify the condition, and the test can be, how can I decide if he has nerve root involvement? Patient is saying that the pain is radiating to the leg and he's not having any symptoms like tingling or such things like that. So how we will rule out that there is no neurological involvement and there is no neurological deficit or there is no nerve root involvement? Which test would be useful to rule out more serious conditions such as malignancy? We also have to identify the malignancy or other conditions that can be situated inside. Now the very last, we have identified the 4 parts, the 4 categories: effect of intervention, experiences, prognosis, diagnosis. These 4 categories are being maintained. But there is another category which is not being mentioned anywhere, but that is really necessary and that should be particularly known by the physiotherapist, and that should be in clinical practice too. That is harm or etiology. Is heavy weightlifting the most likely cause of the problem? Now, this is the really important question which should be arisen in the mind, that is heavy weightlifting is the actual problem? We are going toward the actual cause. We are going towards the harm. We are going toward the etiology. How did this harm happen? So these are the basic categories or the classifications which we will have for making relevant clinical questions. Now we are proceeding forward and we are going to just give a bit detail that we have chosen to start with the questions about the effect of intervention. Why so? Because it is the most important sort of question. It is the most important sort of question. So I was mentioning that the effect of intervention is considered the most important sort of question in the practice. Most of the thinking and concept in the evidence-based physiotherapy has been developed from the research on the effect of intervention. Then we will move towards the patient experiences. Then we are going towards the prognosis and then diagnosis. So these are the questions closely linked and they are really effective. Finally, we consider questions about the harm and etiology. The separation of clinical questions into about intervention, experiences, prognosis, diagnosis, they are the thing for which we need to strive a bit little. Because if these questions are not being categorized, if we are not having the categories of all these questions, we will not be clear about the condition and we will not be able to make high quality clinical research about all these questions. Now the next part, which is regarding harm and etiology, this is about the last paragraph for this topic from the book, and it is just saying that our impression is that physiotherapists frequently ask another class of the questions about etiology and the harm. What is that class? What does that mean? We just previously mentioned that heavy weightlifting can be the cause of the problem, so that was the harm. These questions are of great theoretical importance, but they are usually not immediately relevant to the practice. This is a thing which I just mentioned recently, that the harm part or the etiology part, the physiotherapists sometimes lose focus from this part, from this clinical question. So for whenever you people are coming into practice, you are studying this part, so you will keep into notice and you will keep into action that you will not leave this part, and you will also take care about this part. There is one type of etiological research that is of immediate clinical importance. And what is that? What is that immediate clinical importance in that situation is that physiotherapy seldom believe that some treatment in the field of physiotherapy, we are not clear about the harms of some treatment. For example, that infrared rays can also cause burn. The cervical manipulation is one of the intervention to produce occasional harms. Now, when we are saying about cervical manipulation, it is a part of manual therapy and the intervention is being done. It can cause harm occasionally to the patient. So what we can do in that situation, we need to do the clinical researches regarding these interventions which are producing harms to the patient. It causes harm so infrequently that the studies of the effect of cervical manipulation do not provide a useful estimate of the harm that is being caused. So when the studies are not being conducted, when the occasional harm is so inadequate that it is not in the practice for the most of the time, but it seldomly happens, or it happens unusually that you do not even mention it in the research. So the practitioners sometimes do not get the actual evidence regarding that situation. This research on the harm caused by cervical manipulation is the most often of the same times as the traditional etiological research. In general, the evidence of the harmful effects of the intervention will often come from etiological research. So that means that we also need to do etiological research to identify about the harms of the treatment we perform in the daily life, for enhancing the evidence base, for enhancing the high quality clinical research. Because we have to keep striving. If we do not achieve that level of the research when we have reached high quality clinical research. So this was all about the today's topic. I hope you guys are clear about all the questions. You guys have get to know that what are the relevant clinical questions and how we can build raw clinical questions and how we can categorize them according to category. I'm just going to give a brief review of all the questions, all the categories. The number one is effect of intervention. Number two is experiences. In experiences, we mentioned both patient experiences and physiotherapist experiences. In the third category, we mentioned diagnosis, prognosis, and in the fourth category, we mentioned diagnosis. And the last category, which is not considered vital and which is not in the practice for the most of the time, that is the harm or etiology. So now you guys are clear about these questions. When you will come into field or the practice, you will do the research on the harm or etiological process, so that most of the people can be benefited from this part or this aspect, and we can get most of the researches, and more of the researches coming from the Pakistan, and the world or the people or the worldly people can rely on our researches, that we are also producing effective researches. As research is always being done when there is the gap between knowledge and practice, so we are, as long as we are proceeding in the topics, we will get to know about all the gaps, and you people will keep it in the mind regarding these topics. And in the final year, when you have to do your projects, you will practice, or you will choose these clinical topics or these topics for your project thesis or final year thesis. I hope everything is clear to you people. If you still have any ambiguity or any confusion or any question, you guys can ask me directly. You can call me anytime. You can contact me. You can message me. You can text me. Even you can comment out here for the video. I will surely respond you about all the questions you will ask me. Thank you so much guys. I hope you will be clear about everything now.